Welcome to the Seniors Flourish podcast, where it's all about helping occupational therapy practitioners disrupt the norm by throwing away the rainbow art and being the best you can be when working with older adults.
You know when you have those patients that don't want to put up handrails on the stairs or outside the house because they're afraid it'll make the house look ugly or make the patient look, quote, old? Well, I found these handrails from Promenaid that are super stylish, come in all sorts of finishes and colors to match any type of house. I like that they're super adjustable and you can literally put them anywhere, even those funky corners where the patient needs something but nothing ever quite fits. They ship quick and be installed right away, so we can adapt the home to what our patient needs fast, which is our number one priority. Check them out at Promenaid.com, Promenaid.com. Welcome, everyone, to the Seniors Flourish podcast and the Speaking of OT Between-isode. My name is Mandy Chamberlain.
And I'm Sarah Stromsdorfer.
We are occupational therapists, and we are going to be talking today about specialty certifications in the land of OT. So it'll be good because we're going to kind of just go through some general certifications that you can get as an OT. Some of them are for OT assistants as well. And we'll kind of talk about that a little bit later. But we like to start out with some like little fun story or question. It kind of just breaks the ice. Like, you know, like if you have those coworkers, wouldn't it be fun? Like you were saying earlier, Sarah, that like, wouldn't it be fun if you had a coworker, your coworkers, you just started out the day with like a funny, like kind of get to know you, let's hang out, let's get to know each other question.
Yeah, just like one fun fact of the morning or even at lunch. Hey, what's
we should start,
what do you like
start
to do?
that? Yeah.
Yeah. Start that. So coworkers from my hospital, if you're listening, let's
yeah. It'd be really funny.
Yes, that would be great. So today we'll start with that fun question. Mandy, what was the first tape that you owned?
Isn't that funny? We're talking about tapes. I know we were kind of like throwing out questions. I know. And I was like, how about first tape? And I was like, did you own any tapes, Sarah?
Like, Mandy, I'm a 30. I have plenty of tapes.
Oh, my first tape is actually, I remember there's a couple things. I remember my first, I probably was like 4 because I lived at a certain house. So I must have been at least, I was under 5. So it must have been probably 4. But my first one was Michael Jackson Thriller. But I was kind of scared. I was actually kind of scared of the actual song Thriller, but I kind of like tape. I like wore it out. And then I also had Elvis Gold because I was a huge Elvis fan. So those were my 2 first tapes. Maybe not my most beloved tapes, but definitely my first tapes that I remember being like super excited about getting. What did you have? Oh gosh, Sarah, what did you have?
I think I also had Michael Jackson. It might have been Beat It, but I'm undecided whether it was that Ace of Base or Meow.
Good one.
Meowie Christmas by the Jingle Cats. That was my favorite throughout the year.
Meowie Cats?
Meowie Christmas by the Jingle Cats. And Mandy, have you heard of the Jingle Cats?
Has anyone heard of the Jingle Cats? That's what I want.
Well, if you haven't, I do have a little bit of a sample.
Oh my gosh.
August.
Okay.
Christmas in
okay.
August.
Meowie Cats. Here we go.
This is Jingle Bell Rock. Enjoy.
Oh my gosh, Sarah.
Have you ever heard anything like that?
And you listened to it all year?
Yeah. Still going. Yep.
Okay. Taking a deep breath.
Deep breath. Serious. I did love, because I'm a dog and cat lover. I foster dogs and cats. I'm obsessed. Yeah. So I did listen to this year round. Thank you everyone for putting up with. Mandy had not heard of Jingle Cats, so I really wanted to share it to Mandy and the world of occupational therapy. That'll maybe be the last time you ever have to hear it, but it is on YouTube. Oh my gosh. It's on YouTube. If you are interested in more, check it out.
I'm not lying. I'm crying right now. Okay. I can't beat that. Oh my gosh. Okay.
Tell us, everyone, what, first of all, did you listen to Jingle Cats? Or What was your first tape? It doesn't have to be animal related, but we'd love to hear it.
It doesn't have to be. And I don't know how to segue from jingle cats into specialty certifications, but I'm going to try.
We're going to dive right into it.
Dive right into it. Adult specialty certifications. Whew, okay, here we go. So the first one. I'm sorry. Okay, first one, specialty certifications. Pull it together, Mandy. All right. It is certification in gerontology. So
the first ones we'll mention, just quick side note, these are provided by AOTA via their application process. And then we'll let you know when we veer off of the AOTA specialties.
Oh, that's a good segue. Yeah. And you can get all of these, like look at all the board's specialty certifications on AOTA, like there specifically. And then they also list out what are the board certifications just for occupational therapists. And then what are some specialty, because they do board certification. So that would be just OT. And then you have specialty certifications, which are for OTs and OT assistants. I think the tricky thing, just kind of before we kind of roll into it, is that, like it's really hard sometimes with OT assistants. I feel like they get limited on some of the certifications that they are able to get, which kind of blows my mind. But then also like it's hard because sometimes you can't use it up to its full potential because maybe the OTR that you're working under is not certified. So that maybe, so technically it's the supervise, they're supposed to be able to supervise an OT assistant. So it gets kind of a little funky.
Yeah, that's good to know.
Yeah. And that's the things I think are really, I've heard are really super frustrating for OT assistants because one, the limitations on some of those that they just don't let them get certified in. And then also, like the certain techniques that they actually have learned, but they can't utilize because the OTR doesn't know it because they're not certified. So you know what I mean? Like it gets kind of funky that way. So just kind of something to keep in mind. Doesn't mean you can't get certified in some things. So first one is gerontology. And like the gerontology one is like Sarah was saying from AOTA, but that one is, it's a board certification. So that means this one is just for OTRs. So, and I know you do have to practice for 5 years, minimum of 5,000 hours, a gerontology experience, of any capacity, and then a minimum of 500 hours delivering OT service in gerontology. So you have to kind of like verify employment and kind of go through the process to get certified in gerontology. And I personally do not have any of these kind of board certifications. Do you have any board certifications, Sarah?
I do not have any certifications.
You do not either. Yeah, I have PAMS and then went through kinesiology a long time ago. And we can kind of go through that, or not, like kinesiotaping.
Kinesiotaping,
yeah. But you have to kind of keep up with it. So I haven't done that, but I did get it at one
that would be a good one to have too, especially if you're working in subacute rehab or inpatient rehab or outpatient. I
actually even think in skilled nursing, I mean, we can kind of talk about that, but I think it's actually way more helpful than people actually really realize. So first one is board certification in gerontology.
And kind of getting into also talking about rehab, skilled nursing, inpatient rehab, another board certification is physical rehabilitation, which is another AOTA board certification. The eligibility requirements are very similar. Completing the application, evidence of your portfolio, and examples of completed work. And we'll link to all of these certifications plus more in the show notes on a blog post. Also with the physical rehabilitation certification, having 5 years practicing as an OT, doesn't have to be in rehab, but you do need 5,000 hours in any capacity of physical rehabilitation. So subacute rehab or skilled nursing or inpatient rehab, and then a minimum of 500 hours delivering OT services in physical rehab within the last 5 years, and verification of employment.
Yeah. And I mean, if you've been working in some of these settings for a long time, like it's really not as hard to get some of those hours as you may think. It kind of sounds like, oh my gosh, like, but
5 years, I feel like at that point you would have.
Yeah.
those hours for sure.
Yeah, those hours for sure. Yeah. Another one is like driving community mobility. So things like same type of thing, like with AOTA, how they kind of go about it is it basically is a lot of the same, kind of same guidelines. They may have different hours for some of these board certifications and things like that. So same with the driving community mobility. This one is for OTR, minimum 5 years of OT, minimum of 2,000 hours as an OT, specialty not required for these hours, but then a minimum of 600 hours delivering OT services within driving and community mobility within the last 5 years. So, just depending on what kind of setting you're working in, that is actually kind of hard because I kind of looked into that at one time, working kind of in a rural, at the time I was working like in a rural setting and there was no one really doing that. But like for me to get those minimum of 600 hours delivering those services in driving and mobility, like wasn't going to happen.
That would be hard. Yeah.
Yeah. You can't, you can't, you almost can't do it. I mean, because you're like, you want the experience, but you want to provide the service, but then there's no one to get the direct mentorship or have it that, to get 600 hours with, I don't know. It just depends on what setting you're in, I think, but I think it would be a really great one to have, especially in those areas. I mean, like where I live, like if you wanted to send a patient to see a driving rehab specialist, like an OT, I mean, it's at least 2 hours away. So then people just don't do it. You know what I mean? Like it just doesn't happen. So that's why I kind of looked into it one time. I'm like, oh, that might, but then it's like, oh, you have all this experience or, these hours. And I'm like, oh, dang it. Like, that's not gonna work. So,
yeah.
Anyway, just some food for thought on you can't get a certification if you don't have the experience, but then you can't provide the service or you can, but just in a different capacity. So anyway.
Yeah, that's tough. There's such a need for it, but yet, like you said, it's just so hard.
Yeah. Yeah. I know.
Mentorship.
Yeah. What are some other ones?
Another one that there's a really big need for everywhere, especially in the rural population, is environmental modification certification. So like home modifications. This is also AOTA, so similar eligibility requirements with you need your degree in OT, so OTR, minimum of 5 years of practicing, minimum of 2,000 hours as an OT, so a little bit less, specialty not required here. And then a minimum of 600 hours delivering OT services within environmental modifications. So not as many hours needed, which is probably helpful. Like you said, similar with driving rehab, there's just not a huge amount of people doing home mods everywhere.
Yeah. And I think it's really tricky because I think like with some of these certifications, I mean, maybe you don't, but like you've heard the argument saying like, okay, like I've been trained to do home modifications. I can do home modifications. I think it kind of just depends on your setting. If you want to go into specifically maybe private practice into, like home mods or any of these specialty things. Obviously if you want to kind of specialize in it or make a private practice around it,
it would be easier to have those hours.
Yeah. Yeah. Because I mean, some of these things that, I mean, obviously like another one is like low vision as an example, like, we know the basics of low vision, you learn, you know what I mean? You can take courses on it, but like getting certified is a whole nother level.
And you can definitely work in these settings without having the certification.
Yeah. Yeah. Yeah, absolutely. And if, I had, Cami Colwell, she's an occupational therapist that I have a podcast episode all about low vision. She got certified through Mary Warren, and she loves it. She loves being a low vision therapist. So if you have any interest in low vision, check out that podcast with Cami Colwell. I'll put that link in the show notes, but she talks about all sorts of things that she looks at, and she gave me lots of ideas as well of things that I can be doing a little bit different in my practice, and am I really addressing it? But because because she's certified in it, it's just a whole nother. You're just looking at it so differently, and it was great to have those little tools in the toolbox. But same thing through AOTA, minimum 2,000 hours working as an OT, and then 600 hours delivering OT services within low vision within the past 5 years.
Yeah.
So those are some of those big ones. What? Sorry.
The Mary Warren course, even if you don't get the certification, I've heard awesome things about just taking that course, just learning so much more about low vision in your general practice.
Mary because when I first started, I addressed it, but I honestly, looking back, didn't give it the weight that I probably should have, and how it in fact affects everything. And when you know that, right? You're like, oh yeah, I totally know that. But like, how much am I really screening, or what am I really looking at? Right. So I don't know. This is one of food for thought.
Yes,
is it right for you?
Speaking of OT, just speaking of continuing ed.
There we go.
On to the next one. Certified hand therapist, so becoming a CHT. This is a really popular certification because a lot of outpatient or surgery centers, they only want to hire you if you have your CHT certification, but you can certainly work in a lot of hand therapy clinics without having that. Mm-hmm. It is, right. I hear it's a pretty hard one to get. I have heard the CHT exam is pretty challenging. You also need to be working for 3 years and have 4,000 hours of direct hand therapy practice experience. And that CHT exam is
brutal.
I've
heard it's brutal. Yeah, I've heard it's brutal. I've never taken it.
Yeah, I haven't either, but I hear it.
Yeah.
But a great certification to have if you're interested in, if you're working in hand therapy for a few years and really want to go that next step. That's a helpful certification.
And even kind of not similarly, I mean, along the same lines as like a certified lymphedema therapist. I also did a podcast on lymphedema. So that's a really kind of interesting one too. But, it's one of those things, like, I think, people are kind of looking at it. Employers looking at it a little bit more as obviously a specialty area, because it definitely is a specialty area.
Definitely.
And I mean, I think there's a lot more therapists that are being employed through that, even in like home health settings. So I think that's like I feel like they could employ way more lymphedema specialists.
Absolutely.
In home health. Because there's so many
things to know and contraindications that a general therapist might not know. Like, I get nervous about it. And I feel like having that certification would just make you so much more comfortable doing things with lymphedema.
Mm-hmm. Yeah. And, I think it'd be really neat. It kind of depends because, you have clinics that are just that's what their focus is lymphedema. And I actually know it just kind of depends. I guess how I'm comparing it to hand therapy is like, a lot of times you get a hand therapy certification and that's all you do, right? Like, you just do that. And that's kind of the same with lymphedema. You can just work at a clinic where that's all you do is lymphedema, or you can work in maybe something a little bit more general or home health, and you're kind of doing a little bit of both. So it kind of just depends on what your focus what you want to be. But the course is 135 hours long. It has classroom instruction, home study, and currently the course is about $3,200. So Wow. It is an investment. Yeah. But the people I know that have it really love it. And so,
and it's your
something
career,
that you're super interested in. Yeah, absolutely.
Definitely.
Yeah, for sure.
The next one that you can get is an Assistive Technology Professional, or ATP certification. And I actually took an ATP elective course, and I found Assistive Technology to be super interesting, going through even low tech to high tech assistive technology, because we use it so much in our practice, whether we're in even acute care to outpatient, all the settings we are educating on the assistive technology. The requirements for this is not an AOTA certification. You can have a variety of educational backgrounds, so you don't have to be an OT. You can even have a high school diploma to get it. The total hours will depend on your degree received, 10, 20, or 30 hours, I guess, depending on whether you have a high school degree or master's. And half of your training hours need to be met at a special approved continuing ed unit. It's IACET, and we'll have this post on the show notes, and the other half can be fulfilled by other continuing ed credits.
That's interesting. Well, that's probably why you see a lot of durable medical equipment providers, DME providers. A lot of their employees get the Assistive Technology as well. Have you seen that?
Yeah, I have seen that.
In addition to like, maybe seating and positioning or something, but there are a lot of them are ATPs too, because they don't require you to be a therapist by any standard, really. But you know what I mean? Like they kind of let anybody that can go through the course. So, I mean, not saying it's a bad thing. I'm just saying like, you don't have to be an OT to get that certification specifically.
Yeah, just kind of an extra if you want to work in a certain path.
Right. So, kind of like piggy banking on that, talking about the seating and mobility specialist. So in order to get the seating and mobility specialist certification, you do, I'm trying to remember. I think you do have to already have your Assistive Technology Professional, ATP certification, and 1,000 hours or more in seating and mobility related service with consumers at any time in your professional experience. 2 types of professional activities in the last 5 years. So continuing education, client service delivery, mentoring, presentation, leadership. So they kind of let you do a combination of those types of professional activities in order to get that specialty, the seating and mobility specialist. But I mean, I do think I never looked into that one specifically, but I think it would be, it's so helpful, especially if you're working, of course, if you're working maybe like an inpatient or even outpatient skilled nursing, you would use it a lot. Like even if you don't use some of the high tech, but just getting some of the basics and having a really good understanding of seating and pelvic stability and kind of starting there. Mat evaluations, if that's not something that you're comfortable with, I really recommend it because it makes seating and mobility 100% easier. So if you have a good understanding of how you start with the pelvis and how everything else kind of stems from there, it's really good. So yeah, I've taken some extra courses through the years and I've done a lot, but I'm not specialized in it at all. So, but it's kind of I think it'd be something really neat to look into
for all of adult-based disciplines for sure.
Yeah, for sure.
The next one that I am really interested in getting in the near future is the Certified Stroke Rehabilitation Specialist certification, since neuro is my population that I mostly work with, and I really enjoy working with stroke population. The current requirements, you have to be a licensed occupational or physical therapist, and the program includes 4 8-hour seminars costing a total of $800 for all 4 courses. And it also includes there's an additional cost of the exam from $150 to $175, depending on the National Stroke Association membership. But I have multiple coworkers that say this course is well worth every penny. They learned so much. They found it really helpful. It is a little pricey, but it's just great to have that extra educational component in your back pocket.
Yeah, for sure. I have had a couple coworkers that have had it and they've said the exact same thing. If it's something, that one, and then also I've had coworkers that are certified stroke rehab specialists. So then I've also had some coworkers that are NDT certified, Neurodevelopmental treatment certifications. Yes. So kind of depending on what your population is, you can kind of get a certain certificate in, if you're working with kids, versus like adults with stroke and brain injury. And there's a couple different, things like that, but, apply within 12 months, a successful course completion. It's making the investment, but every person I don't know anybody that has gone through either one of those that works with, stroke patients that have had a stroke or a neurodiagnosis that said that they didn't think it was worth it. They've learned so many additional, tips and tricks and really have a good understanding of progression and handling and treatment ideas and things like that. So
yeah, that's another one that I definitely would like to take in the near future.
Yeah. I think those are 2. But I mean, if you're working a lot with that population, I think I completely agree. It'd be a really good one to kind of look into.
Another great one, working with older adults, especially a certified aging in place specialist certification. So with this certification, you complete the following courses. There are 3. bear with me. Marketing and communicating with the aging in place client is the first one. Design concepts for livable homes and aging in place is the second. That sounds really interesting. All of these sound really great. And the third one is details and solutions for livable homes and aging in place. So you take those 3 courses, and then you will complete an online CAPS graduation application, sign a copy of the Code of Ethics pledge, and pay an application fee ranging from $300 to $500.
Okay. And I think that's also another one that you don't have to be an OT. Like, I think, oh my gosh, I hope I'm not butchering this, but I think you can be like an architect and get the CAP certification, or I don't know if it's a builder but like you don't necessarily have to be an occupational therapist to get that CAP certification. But I think it's a really neat certification if that's something, especially if you're wanting to do private practice. There's people who are in private practice or working privately with like designers and builders and those kinds of things on working and aging in place. And I think that's the type of person that it would be a really good partnership with some of those other professionals, and then also maybe a private practice. I don't actually know personally. I'm trying to think of, I don't know anybody that is not in private practice that has this. I'm not saying that people can't. I'm just trying to think of an example. Like if you did home health or something, maybe, do you know what I'm saying, Sarah?
Like better, I'm just if you're doing private practice home modifications, I think it would be really good, but you might not necessarily need it if you're doing inpatient.
Yeah, right. I mean, maybe I'm sure there are people who work for other employers that have it. But everyone I know that has it is private practice. So it's kind of something, but it's a neat certification to have.
Definitely.
Yeah. And then, there's all sorts of other little certifications you can get, certified diabetes educator. I think it kind of depends on your facility and setting, what kind of, what your goals are and what you're trying to accomplish. But like at one of the facilities, I know the certified diabetes educator, we had just a couple of them. We had a few nurses, and then we had 2 registered dietitians. So, it kind of just depends on what your discipline requirements are. So like I do think it has to be a health professional, which obviously includes us, but it doesn't mean you have to be an occupational therapist. You can need a couple, 2 years of professional practice and obtain 1,000 hours providing diabetes education. I think diabetes educator would be a great certification to have, especially obviously depending on what setting you're working in. I think OT would bring a really unique perspective in addition to just having that certification. Because we do a lot of education and we're looking at a lot of different things in our own evaluation. Let's say if you're seeing a patient in home health and you're checking to make sure that, you have a nurse there looking, make sure, but can they actually, use the glucometer? Can they actually, do they have the fine motor? Do they have the vision? You're looking at the patient from a holistic perspective. And then you can add that, diabetes education, which we do to a point, but it's not the same.
Yeah, it would be nice to have that like full, like even more knowledge with the specialty, just to really, because so many of our patients have diabetes and they have complications related to diabetes. So being able to educate holistically, like you said, you just have that much more knowledge.
Yeah. Yeah. So I think that would be that would also be one that I think would be really interesting that I would maybe, considered. It just depends on the setting you're working in, because, some people have been doing it in some facilities, like the nurse has been doing it for so many years or whatever, there's all these, things that get in the way sometimes, but I think or even maybe just having it for your own pocket to learn more about it. Because I even remember like in school, like you learn the basics, right? And then I kind of remember some of my first patients that had diabetes, because I did home health right out of school, and you're like trying to figure all this stuff out, and you're like, oh man, I have to like refresh on all this. All this, like how does even the glucometer, how does it work? Like, and they're all different and that kind of thing.
It changes like every few years too. So it's nice, even if you don't get this certification, but taking continuing ed on diabetes management, that would be just great for any occupational therapist working with adults to do, just to keep that knowledge fresh while you're providing education.
Yeah. Yeah. And then just kind of like me as a side note, just kind of a couple little certifications that aren't necessarily as like, I'd say intense as these, maybe like not board certifications or huge full on specialty certifications that like we kind of talked about today. But from my own experience, two that I think are really also are really beneficial, that have been beneficial to my practice, is a PAM certification. So
Definitely.
A physical agent modality certification. Some states require it in order to use physical agent modalities in practice, and some states do not. But I had it when I worked outpatient, because actually I think, what's interesting is people always assume that I've always just worked in skilled nursing, and actually most of my career is outpatient. But most of my outpatient clients were older adults, and I've worked in, like I said, home health, inpatient, and skilled nursing. But I've used physical agent modalities across the continuum in all areas of OT that I've worked in. And I think it's just one of those things that I think is really beneficial to patients. Those patients that don't want to get out of bed because they're hurting so much. You can use, interferential, or use, a TENS unit if they're in a home environment and things like that to help get them moving. You're not fixing the problem, but you're helping them overcome some of those things, from that initial, you're going to be doing adjunct, therapy with that. But I just think physical agent modalities has actually been a really helpful certification. And then another one that I have found personally is, kinesiotaping. I'm a huge kinesiotape fan. Like I was saying, you do have to keep up and have a membership and things like that. And because I'm not practicing full time, I don't do that anymore. But even in skilled nursing, I think sometimes people feel like in skilled nursing facilities that some of these certifications might not be, worth it. I don't understand that mentality, but I think kinesiotape has been super helpful for everything from, edema control to neuro re-ed. There's lots of different techniques that you can use and utilize. So if it's something that you are kind of interested in, dig into it and look into them. I mean, all these certifications, there's pros and cons, and depending on your setting and that kind of thing. But I feel like those are two, not huge, but like smaller certifications that are certainly doable, that I think really enhanced my practice anyway. So
definitely,
just my little 2 cents on that. Yeah. But I think those are some of the major ones. Don't you think, Sarah?
Those are the major ones. And there are so many more that we probably didn't mention here. So if you just do a quick Google search for occupational therapy specialties, there are so many that you can find. And if you have your own practice specialty that you want to specialize in, you can Google it. And I'm sure that there's a certification for you. So definitely don't take this as an all-inclusive list.
Yeah.
These are just some of the ones we found, but there are so many. And let us know too, what certifications have you gotten that maybe we didn't include that you would add?
Yeah, that you found helpful for your own practice. So add those in the blog post show notes if you would like. Share with your OT colleagues. I might have to borrow your Jingle Cats tape, Sarah, sometime around Christmas. I think my daughter would love it. Or maybe I would love it, because I was crying just listening to an excerpt. So.
I was just thinking if you'd like to do an outro of a little bit of Jingle Cats for an outro. Let's see. We'll do a different tune. This will be "O Come All You Faithful."
Oh my God.
A few seconds. Thanks,
hilarious.
We wish all of you a Merry Christmas in August.
Oh my gosh. Thanks everyone for listening.
Thanks for listening.
Until next time.
And
bye.
We'll see you later.
Do you feel like you're navigating the OT world without a map? Not feeling confident or competent in your day-to-day treatments and struggling to apply your knowledge clinically? Then be sure to check out the Seniors Flourish Learning Lab membership. It has all of the treatment ideas, patient handouts, clinical resources, community support, and mentorship you need to succeed. Join today at seniorsflourish.com/learning lab.